Okay.
Yeah.
Hello, I'm Sean Morrow. I'm the administrator of LDS Hospital. On behalf of Intermountain Healthcare, I want to welcome you here today to this momentous event. We're appreciative of the media, the way you've helped inform and continue to inform the community regarding the COVID-19 battle. We've anticipated this day along with all Utahns, where we can finally administer a vaccine. And we're hopeful, and I think that's a key word, hope, that a year from now we can look back on this day as one of the major milestones in combating and defeating COVID-19. With that, I'm going to turn it over to Julie Nelson, one of Intermountain Healthcare's employee health nurses, to administer the first vaccinations here inside of Intermountain Healthcare. Julie.
Previous to getting the shot, all the caregivers signed a consent form, and I reviewed it to make sure that there were no contraindications to them receiving the shot.
Sorry. Because you have it. I can't. Down below.
We should have mentioned we have 3 other nurses that will also be vaccinated here in order. So. Our next nurse is Amanda Vischerel. I'm sorry.
Come on up, Amanda.
Yeah, I'll do the chat questions. I can't admit people.
No, I mean, there's some questions about names and stuff.
Oh, I'm adding that. That's me adding the names of the nurses.
Oh, okay. I can't see very well.
Yeah, no problem. Next will be William Brunt.
I'm happy to do it at the but I know it from that because I really don't have any.
Okay, here we go.
And our last in this group will be Sophie Woodbury. While she's coming up, I will say we do have a Spanish infectious disease doc that will be joining us after this. She's just kind of hung up at the moment.
Oh, change it up.
Thank you. Give us just a minute to reset and we'll have Dr. Christian Dascom from Intermountain and Dr. Angela Dunn. For those on the Zoom, we're going to have Dr. Christian Dascom from Intermountain Healthcare join us here. She'll give a few words and Dr. Angela Dunn from the Utah Department of Health. Then we'll take your questions. We'll take questions from the room as well as from people on the Zoom call. For those that don't know, we just take the talk down just a little bit.
Here we go.
Thank you all. I'm nervous for these things, but today I'm actually very excited. Since January, we've been preparing. Our caregivers have had to work very, very hard. They've dealt with the fear of having the first case in Utah. They've dealt with the fear of not having enough personal protective equipment, not having enough hand sanitizer, not feeling comfortable when they're at work or comfortable when they're at home. During this time, we sit with our caregivers. We learn how best to take care of COVID-19 patients and how to do it safely. And now we're standing here with our ICUs very, very full. And we still have caregivers that go home from work on a nightly basis and worry they're going to bring it to their families, and come into work on a daily basis, worried they're going to bring it from their families into work to their teams. But today's a little different. Today we get to have a preventative measure that appears to be 95% effective in preventing this virus from coming to that person. That's a huge accomplishment, and one we are very grateful we can share with our very brave caregivers. Today we get to administer 50 doses at the LDS hospital as our first doses to our very brave caregivers. Thank you very much for sharing that with us. Very shortly, we will have doses at Utah Valley and Intermountain Medical Center starting tomorrow and the next day, and Altaview, McCady, and Logan shortly thereafter. And in the future, many of our other facilities and even our clinics will ultimately get vaccine to share with their clinicians and ultimately our communities. We're grateful to share this hope with our caregivers and our communities in the future. To share in this, we'd like to invite Dr. Angela Dunn with the Utah Department of Health to say a few words.
Thank you, Dr. Dascombe. It's amazing that literally a year ago, we were sitting at the Utah Department of Health on a conference call with the CDC, learning about a novel virus that was originally spread from animal to human and was just spread from human to human. And now we have a vaccine. Again, that's 95% effective. This is a huge momentous day that gives me such joy and pride. We have an amazing state that has come together to distribute and get through all of the logistics. I mean, it's not, making the vaccine effective is one hurdle, and it's a huge one. But getting it out to all the people that need it is another one that takes everybody here to do it right and effectively. I have to say though, my excitement is tempered by the fact that we are leading into another holiday season and it's going to get colder. And this vaccine does not mean that we can all get together now and that we can all go party and have large gatherings. That is not going to come until the fall of September 2021, when the majority of Utahns are vaccinated. So while this is a very exciting point and a very exciting turn in our pandemic response, I urge all of us to continue being vigilant about social distancing and wearing masks, because our hospitals are still at full capacity, and that's not going to stop until we get our cases down. And right now, social distancing and mask wearing is what's going to do it. So please be patient. There is light at the end of the tunnel. We're just not there quite yet. And I really thank you for allowing me to be part of this great, great event today. Thank you.
We're now going to invite our nurses to join us, starting with Monty. And they'll explain their roles here, their titles, and how they are affected by this.
My name is Monty Roberts. I am an ICU nurse in our LDS critical care. And we see COVID every day. And it's super emotional and super frustrating to come in and see patients that struggle. And I think the thing that's difficult about it is that it's every aspect of life. It's not just elderly people, it's all kinds of people. Young people and elderly people and middle-aged people. It affects everyone. And I'm super excited to be a part of this today. I'm super excited to get the vaccination and to be able to protect myself and protect my family and protect the people that I care about. And so I'm just thrilled to be here and thrilled to be part of this. Thank you.
Questions for Monty?
Please.
Monty.
Yes.
You're choking up a little bit. I mean, it's human challenge type stuff, isn't it?
Well, a lot of it is coming to work. You don't know what you're going to encompass. You don't know what you're going to encounter. Some days are better than others. Some days your patients do really well, and some days your patients do very poorly. The second part of that is that when you come into work from the previous shift, your patient may have done very well the day before, and you come in and they're intubated and they're prone or they're paralyzed or they're on lots of sedation. And that's not something that you can really prepare for. And it's a struggle. It's taxing on everyone. It's taxing on the team. It's taxing on you as a nurse, and it doesn't go away. When you leave the hospital, you still feel that. We do the best with what we have, and we move forward with that. We have a great team. We have great individuals that are here at this hospital and throughout Intermountain that do amazing things. And sometimes it's just not enough.
Can you talk a little bit about how getting this vaccine today is going to help you as you do your job?
Well, yes, I'm thrilled about it. One of the biggest things is that we're frontline. And there's many other people that are frontline too. But to be able to have this vaccination and know that there's a potential in the near future that the individuals that I'm actually caring for will actually have that vaccine. And it's enormous because it provides light. It provides an opportunity that this pandemic and this frustration that we're all going through as a community and as individuals and as families and patients, that we can beat this and we're going to come through this together.
Monty, Jason Winwood, Channel 4 News here. Tell me about the next 21 days, because that's got to be emotionally draining too, because you're halfway to getting that second shot. And then what do you think you're going to do personally in your daily life once you get that second shot?
I think that that's a great question. Haven't really thought about it till just now. I think that I'm 21 days closer than anyone else. You know, that's the awesome thing about it. I don't see myself doing anything different. I'm still going to protect myself the best that I can so that I can protect the other people that are around me, so that I can provide the best patient care that I can. So do I see that the next 21 days? I don't think that the next 21 days are going to be any different than the last 21 days and the last months and months before that. Thank you.
One other question, Monty, from Zoom. How much faith do you have in the vaccine?
100%. So I think that a lot of research, a lot of people have dedicated hundreds and millions and thousands of hours. We live in a pandemic, and something that I often tell my patients is that if you don't know what's going on, just turn on the TV. And commonly, looking at what's going on in the world and how many people are dying from this, I think that my faith is in the faith of research. My faith is in the physicians and all of the people that have done so many hours to bring us to where we are. And I'm 100% behind those people, because those people are what keep me safe, that keep my patients safe, and then keep my family safe.
Okay, thank you. We'll have Amanda next. Nothing like dropping things on camera.
Hi, my name's Amanda Viscerelli. I work on the bone marrow transplant unit here at LDS Hospital. This is a momentous day. I'm really, really excited to be a part of this. It affects our patients because they come in already immunocompromised, and this is a huge, you know, these are people that it affects severely. They come in already acutely ill, and coronavirus, if they do contract it, adds to their illness and their stay. They tend to be in the hospital longer, and we have to work extra hard to keep them safe. So I'm excited to get the vaccine, so I can protect, you know, myself, my patients, my coworkers, and my community.
Any questions from that? It's probably like any other shot. You get feels the same and everything.
Yeah, it honestly was, to be honest, it was the easiest vaccine I've ever had. It doesn't hurt at all.
But the meaning behind it, holy cow.
Oh yeah, completely.
Okay, if there's another question, let's have William.
I was waiting for that, but
I'm failing in the one responsibility that I have.
I could have done it too, but. My name is William Brunt. I am a patient care tech on the medical telemetry floor here at LDS Hospital. I worked on the medical telemetry floor for about a year and a half now, so I was able to see the difference between before COVID-19 and now. We're in the thick of it. There's been a lot of uncertainty and worry, and with the nurses I work with and my other coworkers and caregivers, they've been a little shaken and worried about how this is all going to end. It's been really interesting because I'll right at the beginning, you'd come to work and it was, oh, I'm going to wear a mask because I don't feel that well. And then you come back the next shift and it's, oh, now everybody's wearing masks. It's been very interesting, and honestly, you just kind of have to roll with the punches, unfortunately, because we're all learning together. Like Monty said, we have a very strong team, and we're doing the best we can. And I think this vaccine will help us to combat this horrible virus that I've seen so many patients that are very, very sick. One of the things that I most commonly hear is I just can't catch my breath, and they can't even stand up to go to the bathroom by themselves. So it's hard to see that as a caregiver, and knowing that there's not really much we can do about it except give them the oxygen we need and help them with to clear their lungs of the virus, and to try to make them the most comfortable that we possibly can. I'm very thankful for the scientists and doctors that have worked so diligently to figure out what this virus is doing, and I feel very grateful to be a part of it. And I really do love medicine, and medicine is it really is an amazing thing. It's always developing and always changing, to be able to find the ways to live our lives better and healthier. So.
Question for you.
Yeah.
You see things that most people don't. When you hear people that say that this virus is not as bad as it is, or that it's not true, you're seeing things, patients that no one else is. What would you say to that?
So if I understood your question, it's people say that it's not as bad as we think it is. So you're asking me what I think about that.
I've heard people also say that it really is not a health issue.
Okay.
What do you say?
Um,
See patients going through it every single day.
Yeah, for sure. Obviously, I'm not a doctor, but just from what I've seen, it affects everybody differently. Some people will have very mild symptoms, and there's other people like I mentioned before, they can't even stand up without coughing and coughing and coughing. That they can't catch their breath. So I think that would be my answer. Is it really varies with every single person. So yeah.
How's this shotgun, how's getting the shotgun help you?
I think it's getting the vaccination is hopefully going to help other people to be influenced to get the vaccination, as well as me being somebody that works with it on a very frequent basis. Is I don't know that it's going to make me immune. I don't think it will, but I mean, it's the same thing with the flu shot. Once you get that flu shot, you're resistant to it, but not immune. But I think it will just help promote other people to do the same, to take the same step that us four have done today, and other people.
If there's no other questions for William, we'll bring Sophia.
My name is Sophie Woodbury. I'm a nurse on the inpatient surgical floor here at LDS Hospital. I've worked here for about 5 years, and I'm so excited to be here today and to get a vaccine. In the last 10 months, there have not been very many hopeful days. There have been a lot of days that are really a grind, and a lot of days that are really discouraging, and I can see people nodding in the audience, but today is a hopeful day, truly and honestly it is. There is a light at the end of the tunnel, and it's like way far in the distance, and it's kind of dim, but the light is there. And I know that there will be an end to all the things that we're going through right now. There will still be sick people in this world, and there will still be problems, but this vaccine is a huge step forward to achieving the world that we want to live in.
Any questions for Sophie?
How does the shotgun help you do your job?
It's going to help me treat my patients with more kindness and hope, honestly. One of the things that's been really hard about being a nurse is my own mental state. Yes, there's a lot of sick people, and we're doing our very best to take care of them, but it's also really mentally draining. So if I know that I have protection from the coronavirus, and I know that my patients have access to that too, and we can all work together to achieve immunity, achieve healing, achieve recovery, then I'm going to come to work every day in a better frame of mind and be able to provide better care mentally and physically to my patients. I'm so grateful for everybody that made this vaccine happen. I'm grateful for scientists. I'm grateful for supply chain experts, for distribution, for shipping, for regulatory agencies, for anybody and everybody that made this vaccine happen, because I know it's not a one-person job. And just like I see incredible healthcare happening here at this hospital from our team, I know that there are also incredible professionals that worked on this vaccine, and I'm grateful for their expertise, for their knowledge to do something that I don't know how to do and provide me with a service that I really badly need.
I got one for you. Jason Wong with Channel 4 again. Have you thought about messaging? Because a lot of people are going to be looking at you, hoping to have conversations with you outside of the media spectrum to find out what this shot really is. Have you thought about how you're going to talk to these folks moving forward?
Absolutely. The question is, have I thought about how I'm going to talk to other people about the vaccine and contribute in a positive way? Absolutely. I've already started talking to my family. We had a long discussion on our family chat last night about the vaccine and what it means and what it does. I've already had conversations with coworkers early today. They say, "Oh, you're going down to get the shot today?" And I say, "Yeah, yes, I am." And so I'm excited. I've tried to do my research. I try to learn about how the vaccine works, what it's going to do to my body, how it's going to impact me, how it's going to be distributed, what are the side effects, what do the trials look like. I really tried to do my best to learn about it so I can speak accurately and help educate people around me, because that's one of my jobs. I feel like I'm a little bit of an ambassador now. Not that I'm particularly good at that, but it happened, and I'm going to do my best to speak positively and help other people make good and right decisions.
Any other questions for Sophie? Okay, we do have another question for Dr. Dascom. If we could have her come back, we'll take questions for Dr. Dascom and Dr. Dunn now. We'll start with Dr. Dascom because that's the question I have in front of me. Question is, have any nurses previously had COVID? If so, why did we decide not? If so, why did they decide not to take the shot today?
The question is, have we had nursing staff that have had COVID? And if so, why did they not elect to get the vaccine today? Today's event was the first of many. We expect to expand this to several shifts per day. This was specific to the LDS hospital. Yes, of course, we have had folks in every aspect of our care, whether it's a physician, a nurse, even techs that you've met today. All those job areas, we've had people who've gotten infected, unfortunately. That does not preclude them from getting the vaccine. If you have acute COVID-19, you can't get the vaccine only because we don't want you to spread it to those who would vaccinate you, right? But once you're over the disease and through that period of isolation, ultimately, it is best to get the vaccine. Because the vaccine actually has more immunogenicity for you in prevention of the virus for you in the future. So yes, you should get the vaccine. They were certainly not excluded from this event, but we only had 50 slots. So we took as many as we could to get our caregivers here at the LDS hospital vaccinated as quickly as possible.
I have a question for you. Again, Jason Wynn with Channel 4. What's the next 10 days look like? Because I've heard a lot of talk with doctors about how important these next 10 days are for these vaccines. Why is that?
In the next 10 days, we will be receiving our shipments of the first doses of these vaccines, and we will attempt to get them out of our hospitals to our caregivers as quickly as we can. We want to allow for as many shifts as possible, to get as many types of caregivers in as quickly as possible, because there's been a lot of interest in receiving this vaccine. So the next 10 days are going to look like us expanding our ability to vaccinate, providing more shifts, to the point of actually having doctors, nurses who don't normally practice, educating them again to have them volunteer to help give more vaccines. So more of our frontline caregivers, like the ones that you see here, can get it more rapidly. And we can expand that even further so that we can get to our community as quickly as possible.
Can I just follow that up with one more question? Is there any concern for the patients that are getting these COVID-19 vaccines in the next 10 days?
At this time, with the information we know from the 40,000 folks that have received either placebo or the vaccine, there does seem to be some minor adverse events. They all seem to be minor. It's only in a fraction of the folks, and they all are particularly mild. And so we don't anticipate too many issues in the near future. We certainly will pay attention to those who've had anaphylaxis in the past with vaccines. That's an educational point we certainly learned from the UK, but that does not preclude you from getting the vaccine. It just means we'll monitor you to ensure your safety so you can get vaccinated, and we can all move forward with hope.
Question for Dr. Dunn.
Yes, oh, I'm not touching anything,
Okay.
but you're good. Thank you.
I think you kind of mentioned it in the beginning, but what you started where we are today, what's your message going forward to the state of Utah, the people of the state of Utah? You talked about continuing to
Yep.
observe precautions. But your overall message to how the vaccine actually here in the state of Utah starting to be administered to caregivers. Would you just kind of expand on that?
Sure, exactly. I mean, honestly, we're in a much better spot today than I anticipated we would be. We did not see a surge in cases after Thanksgiving. We've held steady. And that's a testament to all the good work that individual Utahns have done across the state throughout the Thanksgiving holiday season to avoid large gatherings, to wear your mask, to stay home when you're sick. We need to do that through December and January. It is so important that we continue to drop our cases. Right now, we're at about 2,000 cases a day. And while it is a lot better than 4,000, 5,000, 6,000 cases a day, it is still too many. At 2,000 cases a day, our hospitals are still at capacity. We still have preventable deaths and preventable illnesses. So we need to continue physical distancing, wearing a mask, staying home when we're ill until the vast majority of Utah gets the vaccine. And again, that's not going to be until the late summer where we can have confidence that a vast majority of Utahns have taken the vaccine and we can rely on herd immunity. So until we get to that point, again, we do see the light at the end of the tunnel, which has been mentioned, which is fantastic. We just still need to be vigilant for the next several months.
You mentioned already that, basically back to normal is not going to happen until fall of 2021. If everything goes perfectly as you hope, why would it take, say, that long to get to the point where we can stop wearing the masks and stuff?
Yeah, and don't hold me to that September 2021. That's my hope. So we still have to get all the adults vaccinated, and it's really not going to roll out until the beginning of the summer for mass vaccination of adults. Trials are still going on for kids. And so if we really want to have a lot of confidence that kids aren't going to get infected and spread it, we need to have that vaccine as well. But having adults vaccinated is a huge step towards protecting kids as well, right? But we still have kind of timeline in terms of vaccine trials going on, and then also the logistics of getting enough doses into Utah to get mass vaccination going, and that won't be till the summer. Go ahead,
Dr.
Jason.
Dunn, are you kind of concerned about Christmas because the numbers were kind of low after Thanksgiving?
Yeah.
Maybe people took your recommendations
I
and
know.
now they may not, or
Yeah.
vice versa, or whatever that
Sure.
may be. But is the state really concerned about Christmas and New Year's?
Yes, absolutely. So we've seen this throughout our outbreak, right? We start peaking in cases, whatever that peak may be compared to where we were. People get really concerned and they hunker down and they follow all of our advice. The cases drop and then we get complacent and we forget about wearing our masks all the time. We go to family large gatherings and then our cases go back up. People get scared, they go back down. So what I'm begging the Utah population to do is to continue being vigilant throughout the holiday season this winter, not get complacent because we did not have a surge over Thanksgiving. We didn't have a surge because we practiced good social distancing and great mask wearing. Let's continue doing that.
Dr. Dunn, we got a question from Lisa Roche at the Solid Could you talk about getting the vaccine out to other parts of the state?
Sure. So currently, I mean, it is a healthcare driven initiative. And as Dr. Dasco mentioned, Intermountain is focused on getting it out to all of their hospitals as well. So are all of our healthcare systems across the state. And that's our first priority, is to make sure our frontline providers have access to the vaccine. And that's a partnership between the Department of Health, the state of Utah, and our healthcare partners.
And I apologize, Lisa's with the Deseret News. I don't know why it's on mute. Another question, will there be a priority for those who haven't had COVID versus those who have when it comes to the vaccine?
Yeah, so right now, healthcare systems at this point are responsible for prioritizing their own vaccine doses. But in general, we are not considering past infection with COVID as a reason to not get the vaccine. You should get the vaccine if you've had COVID in the past. It is reasonable that if you've had a recent infection, you can assume immunity for about 90 days, so you don't have to get it immediately. But certainly if you've had COVID in the past, you should still get the vaccine.
What if, say, not as many adults get this as you want? And
yeah.
The concept of herd immunity, how many people have to get, say, vaccinated before that can even be possible?
Yeah, so what we're looking at, in order for the vaccine to actually start making a difference on the spread of COVID in Utah, we have to get to at least 50%. But to really be sure that COVID is not going to spread throughout our populations, we're looking at 70 to 80% of the population needing to be vaccinated, which is a huge hurdle. When we look at our flu vaccination rates, they tend to be in the 60%. So we're really going to be relying on ambassadors, people getting the word out to their communities that it is important and safe and essential that we all take this vaccine if we're able to do so, so we can protect the vulnerable.
It looks like the Moderna version is going to get FDA approval possibly by the end of the week.
Yep.
How is that going to change the game for y'all especially as far as getting the vaccine
Sure.
to rural areas?
Yeah, so we've already planned for that in our planning and have doses already allotted for the Moderna vaccine to various healthcare systems. So that is already considered in our state plan distribution. So we're expecting it to get approved and start distributing it so that we can get more frontline providers vaccinated quicker.
And that's going to be in the places that don't have
The Pfizer.
the super cold.
Right, exactly. Okay, thank you very much.